Well, even with stay-at-home orders, testing becoming more important in California and becoming available. We're going to talk about two different kinds of tests, but first we'll talk about the COVID-19 virus test itself. These are the testing sites that you're going to see popping up around San Diego, mobile testing sites that you can drive through. This one, One Medical putting together. It's a modern membership primary care organization that started its modeling with 24/7 virtual care, working very well during the coronavirus pandemic. So many sites are doing open-air testing because it's the safest way to keep social distancing and not infect others in an otherwise healthy hospital or doctor's offices. So here you can see this is how it works. This is what you should expect. It's not a walk-in clinic. You have to call a clinician and they'll determine whether or not you need to be tested. If you have symptoms, you'll let them know and then you'll come to the drive-through site. The process is about 5 minutes long. It includes a nose swab and the results are available in about 3 to 5 days. But with the stay-at-home orders, why do we need to worry about testing? If we're sick, just stay at home, correct? Well, we talked to the family physician and regional medical director of One Medical about the importance of these tests and making them available to everyone.
So there's a couple different reasons why testing is important. One is actually from the public health perspective. So we know that countries that started testing early and very broadly, they were able to mitigate the spread of COVID-19 because public health officials were able to do contact tracing. They were able to really self-isolate. On the other hand, the other important reason for testing is the personal reasons it's important for testing. Again, like I said before, people have very complex lives. It's not always easy for everybody to just self-isolate. We might be at home with an elderly parent. We might be at home with a child with asthma. And so I think knowing everyone's complexities in their lives, it is very helpful for some people to know the COVID-19 test results. Even if that results in self-isolation, it helps to know. You know, there's folks with asthma that are debating, is this an asthma exacerbation? Do I need steroids and an inhaler? Or is this COVID-19, which is a different type of management? So we think that it's important to get tested. So we encourage people to reach out to us if they have questions.
Now let's talk about the second kind of testing, the antibody testing that is limited but becoming available in California doctors' offices. It's not available at this testing site with One Medical, but they are looking into it. Governor Newsom mentioned earlier this week that the antibody testing could get California back to work. This is the kind of testing that takes 15 minutes to get results. It's a quick finger prick and it would tell you whether or not you have had the virus or not. This would be for asymptomatic people. We talked to the doctor about this test and why it's so important. Take a listen.
Well, I think one of the biggest things about this COVID-19, it's just that it's novel. It's just that it's new. We don't know a lot about it. We don't have a great data modeling. We don't have great research. And I think that's one of the things that makes it so frightening is we don't have a lot of research on it. And so if we're able to open up that research, if we're able to know who it's infected, it can actually even impact what we think our mortality rates are. The mortality rates might actually be lower than we realize because a lot more people might have been infected and had a mild infection and recovered. And so any information that we can get about COVID-19 is useful because it's just so new.
So these tests are not available to the masses just yet, and their accuracy is still being observed by doctors and scientists. But the antibody test is what's being called the easiest way to get essential workers back to their jobs, even after possible exposure to the virus. If you want to get this test, the biggest recommendation is to call your local physician.